Eye symptoms can be managed conservatively with cold compresses, lubricating eye drops and cool eye gel masks. Saline washes or nasal irrigation has been shown to be very effective. So you have saline rinses and you have saline sprays. They directly cleanse the nasal cavity, they remove mucus, they remove inflammatory mediators such as histamine, and they also have been shown to reduce the bacterial burden or biofilm within the nasal cavity. Interestingly, they have been shown to improve mucociliary function, and this is where the cilia, or like little hair-like structures within the nasal cavity, which allow the removal of secretions from the nose, stop functioning as well during allergic rhinitis, but increased ciliary beat frequency has been noted with the use of saline rinse.